Breathe in and let it go. Hey, I am Dr. Craig Selinger, Craig the Chiropractor. How's everybody doing out there in YouTube land? Today we have Chloe with us. Chloe is a college student here locally at FAU, studying criminology.
Yes.
Awesome. And you used to also play tennis.
Yes.
Great. And you were having some lower back pain, neck and shoulder pain. So today what we're going to do is we're going to be treating Chloe. We're going to be going over some things that we do to treat soft tissue areas in the neck and the shoulders and the low back. So where are you getting the pain in your back?
My lower back.
Your lower back right here, okay. And then when does it usually happen? Does it happen when you're walking around?
Usually from like sitting down or just like in school or stuff like that.
Okay, great. All right. Well, that and it doesn't go down your leg or anything like that. Okay. How long have you had it for?
Probably 7 or 8 years.
Okay. All right. So you're in college. You're a criminology major?
Criminal psychology.
Wow.
Yeah.
Wow. Okay. So why don't we do this first? Why don't we have you stand up? I'm going to have you stand up right over here. And when you stand up and you bend forward, do you have any pain?
No.
Okay, great. Let's have you go back. When you go backwards, any pain?
Ooh, a little bit.
A little bit when you go back.
Yeah.
Kind of towards the end of the motion?
Yeah.
Okay. What about when you go side to side?
No, not really.
Okay. All right, let's have you sit back down. All right. So, what got you into your major?
I don't know. Ever since I was like really little, like I can remember even being like 6 years old, my mom would have like those shows on and I would just be obsessed. So then I started reading like a bunch of books as I got older about it, a bunch of books by people who've been in the field, and then I just got even more into it. So ever since then.
Okay, cool. So I feel a lot of muscle knots in this area. Is this area sore?
Sometimes, usually there is a lot of knots in it. Like a lot, all the time. That's what my mom tells me.
Okay. Yeah, a lot of times students will be having pain in this area because they'll be on the computer a lot, their head will be forward, so that's something that we see quite often. All right, why don't we have you lay down on your stomach right here. Let's check some other things out. All right. I like the shoes.
Thank you.
Look really comfy. And what we're checking for is to see what kind of movement you have in the joints of the spine. We're checking for springiness, and we also look to see if the legs are even. Sometimes when we have misalignments in the lower back or the neck, it can shift the length of the legs. So we do that and we check for that. So I definitely feel some tightness in this area, sacroiliac joint, and down in here. So what we're going to do is we're going to treat this in a little while, and I'm going to do some work on you in this area, some soft tissue mobilization work in here. Okay. So what we're going to do is we're going to use this stainless steel instrument. It's a Factor stainless steel instrument that we use. This technique is called instrument assisted soft tissue mobilization. And we're going to use this instrument. We're going to use an emollient on the skin, and we're going to go compress the tissue in this area to help break up adhesions and scar tissue. We're going to increase the range of motion. We're going to increasing blood flow to the area to aid in the healing. And of course, we're going to help decrease the pain. So we're going to use a little bit of this right here. And you could just put your arm right here like this. And just let me know if this is too much pressure. Feels okay?
Yeah.
All right, cool. All right. And it's normal for the area to turn a little red. And this is a real common thing we see with not only students, but people that work at desks and work on computers a lot. Great. All right. Okay. All right, cool. We're going to do the other side because we don't want you to be not treated on the other side too. Be lopsided. So you go to FAU. What other other colleges have you been in?
I used to go to the University of Georgia for a year, but I ended up transferring back home to FAU.
Oh, okay. So you were a bulldog for a
Yeah,
while.
for a little bit there.
I'm going to show you a couple of different stretches to do because what you're experiencing, back pain in the lower back that doesn't go down your leg, pain that's usually after you're sitting for like 15, 20 minutes in a chair, okay? That's usually a postural, usually being in a sustained posture for a period of time, you'll have the back pain. So what helps with that is stretching. So we're going to show you 3 low back stretches that I want you to work on at home. And this should help your condition. And also, if you're sitting too long, make sure that you get up periodically. And something that would be really good is a lumbar support roll. So like a McKinsey lumbar support roll will be great to make sure you have that arch in your back. Because if you're slouched like this, if you're slouched like kind of bad like that, it puts a lot of pressure here. So we want to have you out more like that. All right?
Okay.
Great. So let's have you lay on your back right here. All right. So the first stretch, bend the knees. Okay. So we're going to do knee sways. So we're going to bring the legs back and forth. Good, just like that. And you'd be doing this on your own. Go all the way here. This is a great warm-up exercise as well. Good, so you'll do that about 15 to 20 times. And then you're gonna bring the knees up, hands on knees, right here, right here. Bring them into your chest like that, like this. Bring them in, out. Very good. No pain, right?
No.
Okay, great. Okay, now I'm gonna have you flip on your stomach.
Okay.
Okay, and what we're gonna do is a press up. I'm gonna have you put your hands by your chest, yep. And then I'm gonna have you do kind of like a push up, but leave your stomach and your lower body on the table, okay? All right, have you come up. You could put your hands up just slightly higher.
Okay. Here?
Yep, good. And then down. Helps build the triceps too, so you're gonna have some big guns there. Ready? Good, great. All right. If that's too hard, you could put your hands right down here, and you could do the same thing. It might be a little bit easier. Good. All right. So, so that's what we're gonna do. We're gonna do an adjustment right now, and then we're gonna do a couple of other stretches. All right. Oh my gosh. Wow, did you hear that? I think you heard that too. Lay your back. All right. One arm here. All that tightness in that mid-back area. All right. Breathe in and let it go. Wow. Crushed it. Okay, good. Good. So what's your favorite TV show?
Probably like Criminal Minds.
Oh, yes. Love it. Awesome. Very good. Awesome. High five. All right. So what we're going to do now, I'm going to have you lay on your stomach. We're going to finish up with the massage gun. All right, good. Sometimes down even in here. One of the things when you're sitting a lot, you got to stretch your hamstrings a lot because when you sit, it.
That's
okay?
so ticklish.
Okay, I'm gonna have you sit up right here. Okay, so we're gonna do some of the areas in here. Good. Here. All right, I'm gonna have you lift your arm like this, hold the side. Good. Good. And just bring your arm here like this. Let's stretch to the side. Good. Stretch this way. Good. Shoulders from all those serves and tennis. Good. Okay, great. Bring that down. Good. All right. Great. All right. So, what I want you to do is make sure you're doing those stretches, and that's going to help your back, lumbar support pillow as well, and making sure that you're stretching your hamstrings. So that's important too. We're gonna also in some later videos, we're gonna go over some proper head position when you're at a keyboard or you're doing any kind of work where your head might accidentally kind of go forward too far. All right.
Okay.
All right, Chloe, it was great treating you today, and thanks a lot for coming into the office.
Yeah, thank you for letting me come.
If you are going to have any soft tissue work done with any of the instruments that we used in our office, make sure that you speak to either a chiropractor or physical therapist. It shouldn't hurt too much. Make sure you communicate with the doctor. Let them know how it feels to you when you're getting the treatment. And if you liked the video, please click the like button and subscribe. Thanks, and we'll see you soon.